Good afternoon, everyone. My name is Charles Knippen. I'm the president of the National Society of Leadership and Success, and I'd like to welcome you to our first webinar in this series called Lead from Home. On behalf of the National Society of Leadership and Success, for those of you who are not familiar with us, I'd like to welcome you. We are a nation of 700 college campuses, over 1 million members across the country, with one single mission: building leaders who make a better world. And that need is no more present than right now in the middle of this COVID-19 crisis. As we as a nation try to figure out how can we best set ourselves up, what actions can we be taking to lead from home, as many states are in quarantine right now, or many states are in shelter in place right now, many people are in quarantine, and you have many peers or other people in your family that may be adversely impacted by this. And so this conversation is very relevant today. And what we're very happy to do is bring a panel of leaders from across the country in three distinct areas. One, the medical field. Second, a student who has been impacted by this. And third, college administrators. Working with over 700 college campuses, there's so much going out on campuses right now in preparation for what's to come, but also what has been happening in their response to that. So what I'd like to do, again, we want a couple of takeaways from you. So you're going to see a presentation come up here on the screen in just a little bit. There's four things that we want to cover with you. The first one is that we want you to understand the facts of the current situation. There's so much information and misinformation being shared out there. So we want you to understand the facts of this crisis. Second, we want you to understand what you could and can be doing, and what you should be doing to help navigate this crisis. And then we're going to also allow you to hear how colleges are navigating this process, as I mentioned just a few seconds ago. And then lastly, we're going to be reviewing some of the questions that you have submitted. And we want to thank our students who submitted their questions. Over 2,000 of you submitted questions related to this, the coronavirus crisis. And we're going to be getting to some of those here today. In addition, we're going to be taking some of the questions that are going to be coming in through social media. You can submit yours either through this Facebook handle, or you can submit them through your other social media feeds with the hashtag #LeadFromHome. And we'll be reviewing those as we go throughout this day. First, though, I do want to introduce our distinguished panel. I want to thank them for being here today. First, from the medical side, we have Dr. Justin Sachs and Dr. Marty Makary, who are here to speak on side of medical. So they can give their little hellos. Second, we also have a student who has been impacted by this, the coronavirus, Connor McLaughlin. He's going to be speaking to that. And then lastly, from the college administration side, we have Dr. Pesca from Waubonsie Community College, and also Dr. Catherine Hutchinson from St. John's University. So without further ado, I want to transition to that first topic, the one that's on the forefront of everyone's mind right now about what is the status of what's going on, particularly from the medical side. We're all concerned about our health and the health of our communities. And so I want to kick this over to Dr. Bakari, if I could ask, what's your perspective on this crisis, and what's important for us to know as a nation of people who want to be healthy, who want to stay healthy, and also get back to our normal lives? What is that current situation happening out there, and what can we be doing?
Well, thanks, Charles, for putting this together, and thanks for having me on. And it's good to see this distinguished panel here. So I want to applaud you for responding quickly, because we are about to have a hurricane hit our country that is 100 times more deadly than Hurricane Katrina. You know, we're a very opinionated country, Charles. Just look at Twitter, which I'm learning can be a nasty place. People have a lot of strong feelings with no information. Everybody feels that they're an expert on everything. And that's really what this social media culture that we live in has generated. Unfortunately, this virus does not listen to us. It doesn't care about borders or political opinions. It's about the data and the math. This is not fantasy football. This is a projection which has been described by the Harvard School of Public Health in a report by the Department of Epidemiology with a virus that has followed the playbook to the T. It has gone through Italy. It has gone through Spain. It is going through these countries now in a way that it will go through the United States. And we're already starting to see New York and the San Francisco region, bustling, and those hospitals are on the brink of being overwhelmed. Now, there are some good news items here. First of all, it's hard for this virus to really hurt somebody very young and healthy. There's someone in their 20s or younger. The case fatality rate is very low, and that in part averages out those subgroups in the US where that case fatality rate is 10 or 15% or higher. So I know a lot of folks on this call are in that group where you are young and you're healthy. And the reality is it's hard for this virus to take your life unless you have a pre-existing condition. But this is one of those rare times where what you do as a healthy person can actually affect the health of a person you've never met before. It is the masses, the younger individuals in this country that are the community transmitters and are the vectors by which older folks and those at risk get this infection and succumb to it. We're talking about the highest risk individuals in society, those who are most vulnerable. Gandhi has a great quote: "The true measure of any society can be found in how it treats its most vulnerable members." Right now, that is older individuals, those who have received an organ transplant, those on critical medications, those who have a pre-existing condition, those with severe disabilities, those with lung disease, those who may not have the strength to be active and get to a hospital. Right now, those are the folks that we're most concerned about in the United States. The other piece of good news, besides the fact that it is relatively sparing of children and younger adults, is that it will probably be beyond us by June. Historically, pandemics last about 3 or 4 months. That was the Spanish flu, that was the Hong Kong flu, that was MERS, that was SARS. And although there can be a risk of reinfection or a second wave, historically, the statistics support the likelihood that we will be back to our normal activity levels by some point this summer. So although we're asking folks to make a major sacrifice in their routines, and we're asking folks to do it for our most vulnerable in society, we are also reminding folks that this is most likely temporary. Finally, another piece of good news is that we're learning great hygiene that will probably help lower death rates in future flu seasons for a whole generation. We probably should have been doing these things for a long time. It's not been that cool to be wearing a mask in public historically. As a matter of fact, if say last year you saw somebody at a grocery store or out in public wearing a mask, chances are at random that person was Asian, because Asian cultures have accepted that you do that routine to reduce the risk to the community. And we are starting to adopt now some of the best practices that will have long-lasting benefits. But if you look today at the death rate in Spain, that is the number of people who died simply in the last 24 hours, that number was 683. That doesn't bode well for the United States. The idea that this virus is somehow contained is an idea we need to abandon. It has seeded everywhere. If you look at the Johns Hopkins map, which is only confirmed cases, it may represent 10 to 50% of the true cases out there. So don't be fooled when you see, oh, there's only this number of deaths, that's far less than the average flu season. This is only a fraction of cases because it's a function of testing and it's a function of reporting. But that number in Spain reported today, 683, in a country that is 1/8 our size. That number means that at that stage at the infection, and there's still potentially 3 to 4 weeks before their peak, and we may be 3 to 5 weeks before our peak. But that number today, the number of deaths today in Spain, according to this playbook, means, translated to the United States population, adjusted for our differences in age and smoking rates, would translate into 5,000 Americans dying in one day. I don't think we're ready as a country for 5,000 or 10,000 people dying per day. And I think that's the number we need to think of, not because we're comparing projections. Nobody here is hoping that they're right. But we are about to experience a rationing of ventilators in US hospitals. Dr. Sachs, a good friend and colleague from Johns Hopkins, who's at Washington University, is going to talk a little bit in a moment about the preparedness and what we're doing to scramble and get ready for this storm. But if you look back at the days before Hurricane Katrina, you know, maybe half of the folks who were at risk evacuated and followed instructions. Another 30% were digging in. They were in denial. They just thought, you know, it can't be that bad. What they're saying is too cataclysmic. Maybe another 10% were just ill-informed. They didn't receive news or information to really know what was happening. And probably another 10% were outwardly defiant, locking themselves in, drinking, and thinking, I'm going to do something that is paradoxical to the warnings out there. Unfortunately, in the United States today, we are still seeing that wide range of responses to this pending threat. New York State has basically announced that they are at their full capacity. A memo from Columbia University by the chair of surgery, a guy named Dr. Craig Smith, who I admire tremendously, and I can tell you as someone in the field of surgery, he's not an alarmist. He's a very rational guy. He's not a conspiracist. He's a very calm surgeon. He wrote in an internal memo that he thought we would be able to accommodate the influx of patients, but that it is very clear that there will be a mass influx that is not manageable. He basically said there are 300 COVID-19 patients at the hospital now, occupying approximately 1/3 of all the beds in the hospital, but only 100 of them have tested positive because the other 200 have not been tested yet, or the results have not come back yet. Doctors on the ground our top priority is not testing and reporting. Our top priority is taking care of people. So the numbers you hear are likely understating the true magnitude. Most concerning in his internal memo, which is on the line and I've tweeted it, is a prediction that he will need approximately 1,000 ventilators to accommodate the influx. We only have 100 to 130,000 ventilators in the entire country. If we have 700,000 patients coming in and needing critical care level support, we're going to be looking at rationing like we've never seen before over a very short period of time in the future, in the next 3 to 5 weeks, in a way that we can prepare for. So I say that not to create hysteria or panic, but to tell you this is our time to think about those who are most vulnerable. This is our time to call them and check in on them. It could be our parents or grandparents. They may be uninformed. Maybe they're not following the data on this problem. But this is our time for our best to shine. This is our time for us to take some food in our home and part with it and deliver it to a loved one, not by hugging them when we show up at their house, but by dropping it off at their doorstep and letting folks know that we need to stick together. So thank you, Charles, for letting me join this panel, and I'll turn it over to Dr. Sachs, who is on the front lines of this right now.
Excellent, thank you.
Marty, thanks for speaking so eloquently on the subject matter, and I'm going to get right to it. So I do plastic surgery, which in the hospital setting, I do cancer and trauma reconstruction. So I put people back together after cancer and trauma. So somebody loses a breast or has their jaw removed, I put them back together, or somebody cuts up their thumb, I put it back on. Marty and I have worked together at Johns Hopkins in the past. He's a surgical oncologist and I help reconstruct people. And now I'm at Washington University in St. Louis as a chief of plastic surgery. And what we're doing now is we are preparing for the surge in patients that are going to be coming in potentially in the week ahead, which means that we are stopping clinical operations. We are sending patients away from the hospital that don't need to be treated in an emergent fashion. So we're only taking on emergencies or urgent cases or selected cancer cases or trauma cases. And really, I'm a frontlines person. This is my fifth, I'm living in my fifth state in the last 30 years. New York, Pennsylvania, Texas, Maryland. I'm now in Missouri. I'm from New York City. I'm from Brooklyn, New York. I'm a public school kid. I went to Cornell. I know what it's like to be in college. I was in a fraternity myself. Okay. I know what it's like to be young and invincible and on spring break. I know what it's like, but I also know what it's like to have a 100-year-old grandpa who served in World War II, who's alive in Brooklyn, and a grandmother who's 98 with him, holed up in Brooklyn, New York. I have family who are over 70, my mom and dad and step-parents, in Atlantic Beach, New York, and Brooklyn, New York, holed up in the house, hoping not to get this because they're in the elderly population. They're still working and vital, but they're older. So my point is, if we are mindful of this disease and know that the people mostly listen to this are not going to get killed if they get it. But if you do get it and you share this with somebody who's older, who has asthma, who has COPD, who smokes, who's on immunosuppression, they're going to need to come to the hospital and go to an ICU. And they might need to go on a ventilator. And when they get there, they might not have the ability to get in that ICU or get on the ventilator. So, you know, I did 10 years of training after medical school, and then I even got an MBA. So I know about microeconomics, which is the allocation of scarce resources. What Dr. Makary mentioned was that we have a limited amount of ventilators. If 100,000 people get sick 1 week at a time, no problem, we got it. But if 100,000 people get sick in a week, we're just about at equal. But if we have 300,000 people sick or 1 million people sick and they need ventilators, we are going to have people dying. And that's the whole point of this. We have to spread it out. You hear about flattening the curve. We got to make sure that the spike doesn't go too fast. So spread it out. Stay at home. Don't get infected. Don't spread it around. We can't test everybody now. We don't know if you have it. You could be asymptomatic, and Dr. Makary can tell you all about that, about shedding the virus, and we're learning about this. But if you get it and you have fun, it might be fine for you, but it won't be fine for somebody who's challenged, who's older, and who might get sick fast. And that's all we're saying here. You know, we're saying think about society. Be that leader yourself in the community, locally, in the state, in the nation, in the world. Because if we individually lead and we spread this out, it's going to be okay. Frontlines doctors. I have residents that I'm in charge of, fellows that I'm in charge of. We're training these people. They are frightened. They're afraid to go take care of patients because they're afraid they're going to get sick themselves. This is a real problem. You have your frontlines healthcare workers, nurses, physician assistants, nurse practitioners. A lot of you on this call will become these people. We are in harm's way right now because we're trying to get everybody to stay home, not to get sick so fast. We'll be able to take care of it. We'll build hospitals, we'll build ventilators, we'll mobilize as it sees fit. But what Dr. Makary said is there's a storm coming. Talk to your friends in Boston, talk to your friends in Seattle, talk to your friends in New York, talk to your friends in Florida. It's coming. And you'll hear about it. So my only thing that I ask, you know, as a surgeon, not an epidemiologist, not somebody who studies this virus, is be mindful of your actions to how it affects the people around you. And know that even though you might feel okay, you actually might be causing havoc someplace else. And it could be your family member, somebody you love. So, you know, that's all I wanted to say. And I'm so happy to be beyond this because I think that if you save one life, you save the world. So let's save thousands of lives today or hundreds of thousands of lives today. Let's all do this together and be leaders together. This is real and it's happening. And in 3 months, when it all passes, we'll all have a big party. But for now, let's hunker down and be safe.
I like that idea, Dr. Sachs. I think for a lot of people, that's really what the core of the issue is, that we've never been isolated to the degree that we are right now as restaurants and bars and social places, and even my kids' playground. They can't go to these places that they're used to every day. And so I know that everyone is looking forward to that day of being able to emerge out of their homes, particularly for those who have been taking this very seriously. But I think that brings up the key challenge is that there are varying levels of which way people are accepting the challenge put in front of them to stay isolated, to do the social distancing. And we see it more and more with the young population in the United States. You may see a presentation come up in front of you, but in the survey that we did of our members, students from the national, from 700 colleges across the country, what we found in over 16,000 responses, 54% think that their peers are taking situations seriously or very seriously, just only half. That 21%, so 1 out of every 5 students of our students went on spring break. 16%, again, almost 1 out of every 5 know someone who has tested positive. But then on the flip side of this, 92% are feeling some level of stress on this. And so, the message is very, very different as we look at this, as we look at the younger population and why we're targeting this message to the younger population, because again, it's not about saving your young, healthy self. It's about saving the more vulnerable around you. And I think that really is going to hit home with our next panelist here. Connor is going to be sharing his story. And Connor, if I could just ask you first, where was your perception of this? Before you were impacted by the virus personally, what was your perception of, the coronavirus and the COVID-19 crisis for yourself?
Absolutely. So my personal, where I was standing with this when this whole thing went on, is I was a part of that 21%. I did go on spring break. However, my spring break was really early. It was March 1st to the 6th. And that was when there were 62 confirmed cases in the United States. And people were still taking precautions at the airport at John F. Kennedy, where I flew out of. And people wore masks in the airport, and they were constantly washing their hands and whatnot. But when I got back, it started to get really serious. And I think all of us, especially the kids that I live with at my house off campus at school, and all my friends that are my age and in college, I think we all kind of took the emergency of the pandemic as, well, I won't get infected. I'm kind of invincible. I'm a healthy 21-year-old. What's the big deal? Whatever. However, that reality really came to fruition for me when I did test positive, and the doctor called me from Norwood Hospital. He said, Connor, you tested positive. I need you to self-isolate yourself for 14 days and make sure that your parents can get a test if possible. And both my parents are immunocompromised. So my father has emphysema and my mother has rheumatoid arthritis, and she is on immunosuppressants for that. So the first thought that immediately went into my head was not that I tested positive for COVID-19 and I was at risk personally. It was, wow, what did I just do? I wasn't social distancing this whole time, and I just put my parents at risk. I put my grandparents at risk. I saw a few of my friends when I got home from break, and I put them at risk, and their parents and their grandparents. And if I got any of those people infected, then I couldn't live with myself knowing that I've hurt that amount of people. And granted, when I did test positive, that's when everybody was starting to take the quarantine really seriously and everything else that the state and the federal government are telling us. And I tested positive on March 20th, 5 days ago. And what was really interesting, and I'm sure Dr. Makary and Dr. Sachs can touch upon this, but I got a call from the Massachusetts Department of Health this morning. And she told me on the phone that she saw me on local news stations and things like that, and me advocating my message for students my age to social distance. She told me that she just received today that my results from the hospital that I just tested positive. So she told me that in the state of Massachusetts, there's a major lag that's happening, a 5-day lag of cases. So if you think about that, the number of cases that you're seeing in Massachusetts is, say it's at 1,000, that's from 5 days ago. It could obviously be a lot more than that. And if we're going to put a stop to this pandemic, and if we're going to save those that we love and the older people in society, then we obviously need to social distance, and you need to quarantine and keep yourself from others.
Absolutely. And for you, I think one of the questions, and I think it was brought up by our medical professionals as well, how did it impact you personally in terms of, were you showing symptoms? Did you feel ill? And what is it that students should expect, when they get this, if anything?
Absolutely. So when I returned from spring break, I was going to school, and then obviously they canceled for a month, and soon enough they canceled for the entire semester. I came home, I packed up all my stuff from my house, and the day after St. Patrick's Day on that Wednesday, I started to feel a little under the weather. I started to develop a mild, dry cough, and then I started to develop a persistent headache that wouldn't really go away. It was just constantly there. I could feel it between my temples here. And once that happened, I'm like, all right, it's probably just allergies. Obviously, I'll still stay in my house, but it's most likely just allergies. So I took some allergy pills, and they proved ineffective. So later that night, my symptoms worsened, the cough and the headache, and I developed some chills, and I started to get really hot or really cold. So I told my parents, look, I'm going to go downstairs and quarantine down there just in case I do have it. I'm going to call my on-call physician, see if I can somehow get a test. I know they're scarce. So I could feel my cough getting worse, and I could feel the cough work its way down my throat. Like, it started in the back of my neck, and I could feel the cough like really work its way down into my chest. So I called the on-call physician. It was like 11 o'clock at night. I said, look, I'm starting to develop some symptoms that may be involved with coronavirus. Both my parents are high risk, and I was with them. So I was just calling to see if I could get a test, and they asked me what my symptoms were. I told them I had a thermometer. I checked. I didn't have a fever, but I started to get really hot and really cold. And the thermometer we have is old and kind of outdated. And following that, I told her about the 3 symptoms, and she said, all right, we're going to get you tested tomorrow. Come to the Norwood Hospital. At this time, she registered me. The process was really easy, and it was efficient. I got to the hospital the next day. They did the test in about 5 minutes. They stuck the Q-tip or whatever it is up my nose. And the next day, the doctor called me, and he told me I tested positive for COVID-19.
Wow. And what was that emotional reaction at that moment when you got that answer?
The emotional reaction when I first found out is I was shocked, and I said, no way. Like, I just couldn't believe that it was me. And following that, my immediate concern was my parents. And I said, well, doctor, what about my parents? My mom has rheumatoid arthritis. My father has emphysema. How can I help them? What's next for them? And he goes, well, you're going to have to try to get them tested. So I told my parents, I had them call our on-call physician immediately, and my parents ended up getting tested that day. And when they got tested, the next day they got a call from the hospital, and they said it came back negative, and I was blown away.
Wow. That all rested on your shoulders for that entire time, though. I can only imagine what that feeling was for you.
Right, exactly.
Yeah. Before we transition, to our next panelist, one question for you is, from your perspective, when you are speaking to an audience of other young people from across the country, what's your recommendation? What's your suggestion or your directive?
My recommendation was, I understand it's super stressful, and I understand it's like, well, what if I get it and I give it to this person or give it to that person? And the doctor told me on the phone, he said, it's impossible to tell where you got it from and who you could have potentially given it to. So I guess my main concern, or the thing I'm going to stress to any person my age, any college kid or 21-year-old, is just do your best to follow the guidelines that the federal government or your state is giving you. Just follow those rules, because they know best. The experts know what they're talking about, and they know the magnitude of it. And don't really listen to social media, because I'll be the first to tell you, I fell victim to that. I looked on Twitter, and I saw the night before I got my test result back, I saw like, oh, if you cough up phlegm, that means you don't have COVID-19, like you're going to test negative. Well, that's false, because I coughed up phlegm into the sink a couple times, and I still tested positive for COVID-19. So don't listen to what people are saying on social media. Go to your trusted networks and trusted sources. Listen to doctors. Go to the CDC website and just follow the guidelines that they give you, because they know best, and that's what's going to get us through this.
Awesome. Connor, thank you for summing that up so well for us. I appreciate you sharing your experience with us. One thing that I'm compelled to do, and I have a tendency to do this, I'm going to go off a little off the agenda, but I think I need to open it back up to our medical professionals. I was going to save most questions, but Dr. Bakari, Dr. Sachs, are you guys having any reactions that you want to share to Connor's story or emphasize any of those points that he was sharing with us?
Well, I'll just say, Connor, thank you for sharing your story. And when you see how his parents are at risk and Connor is powering through this and Connor's going to get through this, but you see the danger and the risk to others. And that those are the people that he knows are at risk. Think about whoever may touch a door handle of an Uber car after you, or at a water fountain, or in an airport on the armrest of a plane. Those are the times when there could be a very dangerous transmission to somebody who's at risk, and some people at risk don't even know they're at risk. But when I see somebody young and doing okay with it, I think, this isn't that bad. And then when I hear of a 47-year-old healthcare worker who's in the ICU on a ventilator because they got it, I think, gosh, this thing is very dangerous. And I think when we think about this infection, we want to think about the spectrum of implications, not just one profile for the infection.
So, hope you're on mute, Dr. Sachs. What else?
Really impressive. The things that you just said and your experience. And I think, it really hit home the point about it's not even about you, it's about the others around you. And I know that when you got sick, immediately you thought, oh boy, am I going to hurt my parents? And that's the point what we're trying to get at with this, with this sort of session together. And I think that, it's just important that you keep spreading that message, and then people hear that it really hit home that you potentially could have compromised your family, not knowingly, not wittingly, but, that it's not just about sort of you getting sick and it being over. It's about you getting sick and about affecting other people around you. And I think that's the important thing that we have to stress here.
Excellent. Thank you both. All right, so let's switch the focus to the audience that we work with as a national organization in our college campuses, over 700 from across the nation in all 50 states. And this has had such a significant impact. And for most of our listeners here today, most likely your college has been impacted. Maybe you're now going to classes online and looking ahead to the future semesters and wondering what the heck is going to happen. And so what I'm very happy to have on is that we have Dr. Hutchinson from St. John's University, and we also have Dr. Pesca from Waubonsee Community College in Illinois, who have joined us today to talk about what the impact has been, again, here in the moment, but then also looking to the future and what their college and other colleges across the country are doing in the midst of this crisis. So Dr. Hutchinson, if I could offer it over to you first.
Great. Thank you, Charles. And thank you, Dr. Makary, Dr. Sachs, and of course, Connor. Connor, I appreciate your honesty and sharing your story with your peers. To all the college students that I am speaking with today, and some might be my very own because we have very large tappers of NLS at our campus. Really just a couple of things that I want to pay attention to. And first and foremost is we at the universities around the country recognize the tremendous impact this has had on each of our students. Each student has a unique situation, a unique story, and unique challenges. And especially when you're a large institution, trying to get to all of your students and attend to them on the most individualized plane possible can sometimes take a little bit of time, but I think most of us are trying to do that in the best way possible. I also want to thank our students for their incredible response. I think we have seen students rise to the occasion. We've seen their resiliency. We've seen their maturity in this time of pandemic, something that none of us have experienced before. And now they, as young people, are trying to navigate that, in addition to trying to navigate from in-person classes to online classes, which we know is not what you selected. And we also know there is deep disappointment in missing all of the activities you had planned for this spring, and the cool internships and the residencies and the travel abroad and all those kinds of things. we feel it too, because that's why we work in higher ed, and that's why we bring those opportunities to you every day. And so we equally are disappointed, but we are trying to make sure that safety and your health and the health of our community is our #1 priority. And so New York, I am at St. John's University, that happens to be located in New York City. And so some of what we're experiencing, many of you may not be experiencing quite yet, but we'll likely start to experience that, as Dr. Makary very eloquently shared with us, in the very near future. And so having students return home, and every scenario under the book. Either students were on spring break, like my own son in college, and told to remain on spring break with all of their belongings, including their books, etc., at their dorm room, or students like on our campus, coming back from spring break and 3 or 4 short days later, watching this thing escalate in New York City so quickly, and we needed to make a new decision, which was a difficult decision. And then, of course, those who had yet to go on spring break, who had a little bit more advance notice to figure out should they take their belongings or not. But most of us believing that by the end of March sometime, probably right around a day or 2 from now, we would be returning to our campuses. And now we all know that most of us will be out for the rest of the semester and perhaps beyond. And so I think your campuses are each trying to make the best decision based on the information they have, not only nationally, but also at the local level, and the speed at which this is happening and the changes are occurring is lightning pace. And so sometimes students will be frustrated because we made a decision and then 2 days later we had to accelerate and enhance that decision and make it a little bit more what would be considered draconian often by the words of students. And that is true. But again, the evolution of this and how it is impacting our communities so rapidly has required us to make new decisions, sometimes hourly and oftentimes multiple times in a day. And so that can be challenging for students. And so what I ask of our students to think about is, as you're watching the news and as you're seeing all those things evolve, that remember, we not only are watching the news, but we are in direct contact with experts and professionals within our community and across the country, and with national organizations that are sharing this information with us so that we can make the proper decisions for the safety and well-being of our campuses. In addition, I think it's difficult to be separated from all your belongings that are in your dorm rooms, and folks are trying to figure out how do we get those back and what do we do and those kinds of things. And we know that's difficult, but we encourage you to think about how and why many of us have closed our dorms and not allowed you to come back in and get your belongings, because we don't know who's carrying the virus and who could then transmit it to others, who could then bring it home to family members, etc. So it's a very challenging decision, and we understand that, and we know that it can be inconvenient. In addition, some campuses, and as we're seeing in New York State, as the numbers are increasing rapidly in terms of, in particular in New York City, in terms of the number of folks who are becoming positive, and the hospitals becoming overwhelmed or on the verge of being overwhelmed already. Universities and our students are quite wonderful in their response. And so many of us have had to stop our clinical rotations, our medical rotations, those kinds of things. And I know we at St. John's yesterday packed up all of our PPEs, the personal protective equipment that we would have been using with our pharmacy students and our PAs, et cetera, and packed all that up to give to our local partner hospital, because we know their resources are almost depleted. We have a faculty member who is using a 3D printer to make shields, to make facial shields for hospital workers in his living room. And we've delivered several of our 3D printers from campus to his house, and he's got a whole factory going on in his living room, because we know that those PPEs are incredibly valuable and important. And so students had worked with that faculty member actually to develop the equation and the analog to make this happen, and away we go. And so the resiliency and the brilliance of college students can really come to bear in helping us think about ways that we can not only help our community, but others. And at the same time, we know that some of those decisions are really challenging and are impacting you. And so what I would encourage you to do is remember you were at that university because you love it and because you chose to be there. And those people care about you. We care about you. And rather than second guessing some of those decisions, recognizing that we can't always sit down and write another memo. My nickname on campus is Memo Woman, because I send out a new memo about every 2 days to students and their parents to tell them what's going on. But also because some of that information involves multiple organizations. New York, as many of you have seen, and will likely happen to many of you across the country, because of the shortage of facilities, they're looking to some of the institutions, mostly the public institutions, but in our case, we're about the only institution in our particular area that is large enough to accommodate. And so New York State is asking us to also accommodate need to hand over parts of our campus so that they can store medical supplies and or potentially house patients there. And so sometimes we have to displace other people's belongings so that we can prepare that to help the greater good. And we ask students to think about the greater picture and to think about your contributions. So many of you are so engaged, and particularly those of you who are involved in this organization are so engaged with doing service to the community and thinking more broadly as a leader. Think about that as a leadership action as well. So I think I'll stop there.
Excellent, Dr. Hutchison. Thank you for that and sharing the real world experience of what's happening at St. John's University at the epicenter of the crisis in the United States. Dr. Pesca, we'll kick it over to you.
Yes, well, thank you, Charles. Thanks for having me as part of this panel, and I thank our medical professionals for being on here, as well as Connor, you're telling your story and sharing this with a number of the students and individuals to talk about how serious this is. I work at Waubonsie Community College. It's a 2-year comprehensive institution just about an hour outside of Chicago. And I think as I commend the NSLS on having this session for us, a large part of what has caused fear and also I think just some challenges is the lack of information or the lack of trust that we can have in the information that we're receiving, whether it's from social media or what. So I think being able to have direct information to be able to share is critical in helping individuals reduce the uncertainty that they're experiencing. And this is the first pandemic that I think all of us are facing. And so I think as we are chartering this new territory, it's about trying to make sure we have good information to base decisions on. And so I would like to echo a lot of what Dr. Hutchison shared. We are trying to work with providing information to our students on I guess, tempering the disruption that this has caused their lives and their studies. And we're focusing on how to move our courses online. As an institution, many of our classes are not online. We have a lot of students who haven't expressed interest in online education or may have some concerns with their ability to learn in that format. And so we're working really diligently with our faculty. We extended our spring break to give time to be able to address those needs. And we're looking at this from a multiple lens, right? So I want to thank, first and foremost across the country, I think that on every college campus, your buildings and operations staff, your IT staff, and your marketing communication staff are just have been putting in a lot of long hours and trying to ensure that their buildings are clean and sanitized, to ensure that we have the necessary equipment and hardware and software for our faculty to be able to offer classes online. We're looking at how to change provisions of student services that typically are face-to-face to be able to put those online to make it easier for students. And so relying on those different staff are critical in this time of need. I think part of it is trying to identify just what individuals have. So we put calls out to our students to ask if those have, if they have need for hardware or if they have need for Wi-Fi and software, and looking at utilizing local resources in our community to help provide that support, looking at what we can offer as an institution as far as laptops or Wi-Fi hotspots. Our IT staff is brainstorming different ways and way we can operate. One of the things they came up with is moving some of the Wi-Fi routing, signals that are in some of the buildings to actually point out to the parking lots. So if there's a need, we could have individuals at least be able to come to the campus to sit in their cars to be able to access Wi-Fi. And so we're exploring a lot of different options that we can provide students so that they have the most control over their situation and how they can still access their learning and continue moving forward throughout the semester. We know it's not ideal. It's not ideal for a number of our faculty trying to learn how to teach online in a different format. And many of them who are very engaging and face-to-face, it's a hardship to go, how do we get to come together? But we want to take this, you know, and do our part. We understand that a number of our, you know, students across all different age ranges have varying responsibilities, whether it's caring for the elderly, whether it's having children that are home now because of the K through 12 school systems being closed down. So trying to work with managing that and helping reduce that uncertainty and what we can, you know, provide as far as to our staff members to be able to work remotely has been a challenge. So I think that you're going to see, at least in our institution and probably a lot of institutions across the country, you know, an increase of online chat services, adjusting hours of operations to be flexible, greater web support and phone support to be able to connect with students that way. And we're trying to look at how we can help students get through the current semester that we're in, and then as we look towards the summer and the fall, how this you know, challenges have we're going to impact those processes and some of the goals and the activities that we had planned for. As Dr. Hutchinson echoed or shared, I just will echo that it's disheartening to see campus you know, engagement come to a standstill. So we're looking at ways in how we can still engage students via social media, encouraging our students to still try to find opportunities to come together, whether it's video conferencing software and making it available to them, or through social media. And so trying to find ways to still capture that vibrancy of our student population, which so much of the college thrives on. So it's a unique experience that we're all facing. We are taking it one day at a time, and it seems like every day there's something new that we have to plan for or account for. And I would just ask that, you know, students and faculty and staff as well, just to say we always want to make sure that we're extending the grace that we hope to receive to those that are trying to make the decisions with the best information they have at the time. And so we're constantly sharing that to them to say, please be patient and to please extend that grace.
Excellent. Thank you, Dr. Pesca. I know I'd like to ask for just two quick follow-ups because the question that we get the most from our students right now is, what about this fall? So I'm gonna start there. You know, as far as what you're communicating, what you're saying, what about this fall? What would they expect from the administrations at their school? You know, and what are your own plans? You know, in working with your administrations there, what are you hearing from others as far as when you try to look ahead and through a pandemic that no one really has a timeline on?
First of all, I just want to address the issue of Wi-Fi. We have done a lot of research on free Wi-Fi for students that don't have it. Spectrum, Comcast, a whole host of those types of organizations have made Wi-Fi free for the next 60 days so that students can access it. And most of your campuses have probably put together a frequently asked questions section on your webpage. I really encourage you to go and take a look at that, because they will have done a lot of this homework for you already. And or if you have specific needs, there will be links and phone numbers and emails to the exact people that you need to get to, so we can make sure that we answer all of your questions and give you the needs that you have. We also know that students are housing insecure and food insecure and all those kinds of things. And I know for my campus, we have a basic needs form out there where folks can fill it in, and then we'll get back to them within 24 hours to try and assist them, because we know that this is a complete disruption to them and their families. So make sure you look for those kinds of things because we want to make sure you get that information as quickly as possible. And now for the magical crystal ball question about what are we going to do come the fall. I think St. John's, like most other campuses, are kind of doing parallel plans, you know, so what do we need to do to ready ourselves if we can have this fantastic move-in weekend like we usually do and all that good stuff, and carry on in September and, you know, look back and learn about and research and look at the data and do all kinds of evaluation on how we did managing our way through the pandemic. On the other hand, I'm really hoping that Dr. Makary and Sachs are correct, that this thing is over by the end of June sometime, and then we can carry forward. But if not, as institutions, we are thinking about what would this look like if we needed to start the fall semester online. What would this look like if maybe we started online and then shifted to in-person and all those kinds of things? So most of us are creating parallel plans, which is obviously a challenging thing to do while you're managing the immediate day-to-day crisis, but nonetheless, what we are doing.
Excellent. And Dr. Pascal.
Yes, we are also, as we look towards the fall semester, we are taking it literally one day at a time, trying to encourage what the planning will look like for the fall semester. I think we're hopeful that we're going to be able to be back to operations as usual, maybe with slight modifications in, still maybe encouraging social distancing or trying to work with some of the new techniques that we're going to learn. I think that, what this has taught me is that, in the need to act quickly, we've been able to show the resiliency and the ability to be flexible and to be able to move everything to an online format. While it's challenging, I think that it will increase the confidence in our students in their ability to learn in different formats. I think it'll also be able to increase the confidence in our faculty and staff and how we provide provisions of service. And what may come out of it in the fall is that we will have new and maybe some increased ways of offering those services that will be more flexible and more friendly for students. So excited about that, but I think, we're looking right now to keep forward with the immediate situation, and then as we look towards the summer first, and then we'll move towards the fall. So again, I would just, as those students, I would say, and I understand there's, every student has a different aspect. I was talking just earlier today with our athletic manager and how some of our student athletes are going to be impacted by the decision from the NJCAA to close down spring sports. And so while it has a lot of different impacts, unique impacts on certain populations of students, we're trying to look through and work and adjust to how those are going to all shape out for next year as well. So we're taking those and putting everything down. Not every decision right now is urgent, and so we're trying to keep our focus on those that are important and urgent for this remainder of this semester, and then we're going to move to the others as that are a little bit less urgent to address. So I would just encourage the students that have those questions to keep them, make sure that they're sharing them with your campus. Most of campuses have something on the web page as far as frequently asked questions, as Dr. Hutchinson shared, and then there's also points of contact on where to share those questions and concerns that you have, and they will be addressed. Just know that.
Excellent. Thank you both. Oh, go ahead, Dr. Hutchinson. You're on mute. Hold on 1 second. There you go.
I also want to address the fact that many of the students that are listening today are probably thinking about their study abroad programs, and for campuses like ours that have campuses in different parts of the world where we had to bring all of those students home way before we were thinking about this issue here. Having a campus in Rome, obviously that made this thing very real to us. So I think I've been in the pandemic for like 5.5, 6 weeks straight here. And then moving our students home from our other campuses and then around the world sites. That's been difficult for those students. Many of them have signed up to go back so they can finish, and then others want to go. And many of those decisions are not going to only bear on what's going on here in the United States, but what is happening across the world. And are they ready for folks to come back? Do we believe it's safe enough for folks to go back? And then also, what are happening with the borders, many of which are closed right now. We've had the experience of students who wanted to go home that were international students who literally got turned away at the airport because their borders had closed 4 hours before, but we bought the plane ticket at 8 a.m. and now it's 4 and it's different, So all of those things are going to impact. So we encourage you to continue to be in communication with your global education departments and realize that a lot of those decisions will unfold probably much later.
Excellent. All right. Thank you both. All right, so now we want to transition to the time where we open it up to you. We want to thank for those of you who have been with us for the last 55 minutes, and we want to get to some of the questions. Again, we've received over 2,000 already, and additional questions that have come in via social media with the hashtag Lead From Home. Our first one really goes first to our medical professionals. There's estimates that that people are saying 80% of the population of the United States are going to get this. And so one, your feelings on that, but then two, the question that is coming in from Sadra Munir is, can a person be reinfected by COVID-19? And if so, how long after recovery can they be reinfected with this? So your thoughts on the 80% statistic that has been thrown out there, but then also on this reinfection question.
Great, shall I start? So, look, I don't like these numbers, and I don't think anyone likes them. That doesn't mean they're not true. Typically when there's something in the modern world that we don't like, we can influence it, right? If the economy is not doing well, there are things that banks and governments can do. There are things we can do. I don't like the fact that the Harvard epidemiology study suggested that 40 to 70% of the US population could get this, but that's the projection. That's the projection they came out with. The revised projection has suggested it could be as low as 20%. I'm not sure those numbers are very comforting either. Governor Cuomo in New York has said that he estimates 50 to 80% of New Yorkers will get the infection given its public transportation system and how congested the city is. If you take a 20% estimate, that means in a country of roughly 350 million, 70 million people will get this, with a case fatality rate of approximately 1%, maybe a little less. And that's about 700,000 people dying from the infection. I don't like it. That doesn't mean it's not true. That's what the numbers are supporting, not only from the experts, but also from the observations now in Spain and many other countries.
I know that if we change our actions and we wash our hands and we stay 6 feet away from each other and we stay at home for now, I don't know what the ultimate numbers will be that who gets this, but I do know that we will reduce the amount of cases and we can change the numbers. So that's the point of this. Let's bust the predictions. Let's go below the predictions. So wash your hands, stay 6 feet away, and listen, as as was said so astutely before from a young student here who got caught COVID. Listen to what the authorities are saying. Your local leaders, stay home, be mindful of others. So I think, to that point, we don't know the exact numbers, but I think we can change the curve.
And what do we know about the reinfection opportunity?
So we've not yet seen reinfections, but we are watching them very closely. In the Wuhan province in China, it appears that the worst is behind them, and they are starting to get back out and active. They are not seeing a second wave of infections. Historically, novel virus strains do not have a high burden reinfection rate, so we're hoping for the best here as much as it is an unknown. Excellent.
Our next question comes from Ashley Winkler. She says, what do we know about fatality rates across age ranges? We have heard immunocompromised and elderly people are most at risk, which you referenced earlier, but I keep seeing middle-aged people dying from the virus. What is that message, or what has been seen statistically out there so far?
This is not a disease of 80-year-olds, as many people think. Actually, those in their 20s are at high risk of getting the infection, but they are at a much lower risk of dying from it. The risk of dying from COVID-19 in somebody in their 20s may be 0.1% or 0.1% or lower, which is very low. But there are cases of folks in the ICU on a ventilator. And I can tell you, as somebody who's taking care of patients on a ventilator, that is a horrible situation to be in. We do know that the inflection point goes up after age 40. So even young parents and university faculty and others are at risk. And then once you start to get above 50, 60, and 65, that case fatality rate can be 2, 3, or even 4%. Among those 80 and older, it is 14% or higher.
Got it. Thank you. Next one comes from a student. As students, besides self-quarantining, which, again, is the message of this, of today's webinar, what is the most effective way to help our communities right now? I can open this up to anybody on this call, as far as, besides putting yourself in isolation, what do you want to see students doing across the country?
I think students have the incredible capacity to show their compassion. So whether that's checking in on people that are vulnerable, maybe your grandparents, maybe your neighbors, etc. Don't go knock on their door, but call them, check in with them, see if they're okay, see if they need assistance. So many of you have done hours and hours of volunteer work with all types of different people, and you know how to send that message of I'm just checking in for goodwill. And to brighten their day, because loneliness is also a huge factor for so many of the elderly folks who now cannot receive visitors at a nursing home, at an assisted living place in their own homes. That can be a real challenge. And I think check in with each other. One of the things that we know about the college age population is there are high levels of anxiety and depression. And now students are rapidly being put into highly anxiety producing situations. And they're trying to focus on doing school a whole different way than before. And they're isolated from their friends. So check in with your friends, see how they're doing. I do those meetups and tweet ups online, those Google Hangouts, whatever your method is, so that you can connect with each other and stay in a place of good spirits, because we know that also is good for your health. And then also, I think, look to your universities. Lots of us are doing, online platform games and hangouts and all that kind of stuff. And we've seen, tons of people taking advantage of that. The first week or two we get that you're trying to move and settle, but now the mundane is going to set in. And so try and stay connected.
Absolutely. Connor, what about for you?
I think, well, it was kind of interesting. I'm sure Dr. Makary and Dr. Sachs could touch upon this. I'm not the expert, but when I spoke to the Mass Department of Health today and they got my test result back that came back positive, I've been in quarantine now for a little over a week. And they asked me how much longer I was staying in quarantine. And I told them, probably 7 to 8 days. I'll probably just stay in quarantine just to play it safe rather than sorry for those other people. And she told me that in 3 to 4 days, since I've fully recovered now, so in 3 or 4 days, staying at 3 more days in quarantine is playing it safe. And then say my family needs groceries or they need a prescription from CVS. The Mass Department of Health told me on the phone that they want me to go to CVS or the grocery store, or any of those places, to get the things we need, not my parents, because my parents have not contracted the virus and they're not immune to it if you can be. So they want me to do that instead. So, I mean, I would say to help others in your community, I think Catherine touched upon it very nicely. I mean, maybe since you're lower risk, help out your grandparents with what they need, help out your parents with what they need, and make sure that you're washing your hands and stuff like that, obviously following protocol. And yeah, that's the best that I think that we can do.
Thank you, Connor. Any other thoughts before we head to the next question? No? Great. So this one is a two-parter question. So I read somewhere, this is from Tanya Bonham. I read somewhere that the COVID-19 virus developed from the SARS virus. It is my understanding that the SARS virus is much more virulent and deadly. Is there a chance that COVID-19 virus could mutate in the same manner? And where do I go for good information and fact-based information on our current crisis? Interesting two parts there. So if I go to our medical professionals, one on the SARS related question, but then also two, where are you directing people to go to say, this is fact, this is where you should go to learn the facts about this crisis and this virus?
Marty, you want to take this?
Sure. So I'll just say that unfortunately, there is no central source of great information out there. The CDC is pretty good, but it lags a little bit behind. I think it's good enough for prime time to use for for your daily lives. I'm the editor-in-chief of M.P.H Today, which is a news outlet for medical professionals. And I think anybody can get on there and understand the information we're putting out there on COVID-19. I do think some of the news is citing good sources and some of it is not. I follow on Twitter BNO, which is a great news source about the global trends out there. And of course, I try to put out the things that I think are most useful on my own Twitter feed, which is at Marty Makary.
Dr. Sachs, anything from?
I think that, we're going to find more about this novel virus. This is a virus that has never seen a human being before. And I think we're going to learn about it. We're going to learn about how long it sheds for, because we're not sure at this point.
Yep.
Could be 2 weeks, could be 3 weeks. But I think the best thing to do is, as Marty mentioned, to go to reputable sites, and the CDC is probably the best at this point, for the most up-to-date information.
Great. Feeding into one of the questions that has brought in a lot of fear for folks across the country. This question is from Mitchell Silverberg. We want to thank them for the question. At what point should one wear a mask, gloves, and goggles for shopping? Is it necessary? Is it where we are at in this crisis? Again, from a medical point of view, what should people be doing to protect themselves when they head out in public to do their grocery shopping, prescription picking up, things like that?
Sure, I can chime in with a quick word of guidance here. Masks and gloves and gowns are not barriers for this virus and do not reduce your risk of transmission. However, if you are symptomatic, it can reduce your contagiousness, and they can be effective. All of these things can be effective in reminding you not to touch your face. So that is where we see the real impact of wearing something, either a glove or a mask, that it reminds you not to touch your face. You're far less likely to do that when you're wearing something.
Got it. So it's not about the actual protection itself. It's not about putting on gloves and the goggles and everything like that. It's actually more about that barrier between your face and the virus.
That's right. It's the virus does not penetrate your body through your skin. It penetrates your body through where there are fluids like your eyes, touching your eyes, your face, and your mouth.
I think that's very helpful information to have. Thank you for that. Going to shoot through a couple of medical questions here. One from Nicole. Is it safe to open packages? How long can the virus live on surfaces? I think that's a question on everyone's mind.
So the virus can live for hours to even up to days on surfaces. Copper and steel on average 2 hours, cloth and plastic on average a couple days. But I don't think you need to worry beyond a day or two, because even though there is detectable virus, it does not necessarily mean that there's enough of a load of that virus to give you the infection. Picking up packages, I think, is not a concern. Receiving food deliveries or giving food deliveries is not a concern, provided you wash your hands before and afterwards.
Excellent. From Jamie Sitz from Sneed State in Alabama. Realistically, how long until a vaccine is ready?
Justin, do you want to take that one?
No, I'm deferring all the high-level medical questions to you. I'm just a surgeon.
Because there is no answer, I deferred to my colleague, Dr. Sachs. But the reality is, it takes time to build an immune response, and those antibodies, increase over time. So no one has suggested we would be able to do this before the fall. And I think if there is a small risk of reinfection, that's where a vaccine could be helpful. There is a lot of interest right now in other medications. But remember, we already have a way to stop the virus dead in its tracks, and it's soap and water. And although Purell and some of these other solutions, bleach and 60% alcohol solutions, as Dr. Sachs has there, they can be more convenient. Let's just remember that frequent hand washing and reminding ourselves that our phones are an extension of our hands. So they are not immune, and you need to wipe the phones down as well.
Absolutely. Great. One thing that, and I'd like to open this up to everyone and their thoughts, and it's actually going to be queuing up our next webinar, the next webinar in this series. How do you recommend, this is from Maggie Botros, how do you recommend facing the psychological effects of social distancing and talking about it to peers, friends, and family, especially as it comes up on weeks for some people already? I worry about the loneliness crisis that has been talked about.
I'd say FaceTime. I mean, I haven't had any human contact with anyone in a little over a week now. So like I haven't, like, I mean, I see my mom, like my mom like will yell like upstairs, or she'll yell downstairs, whatever, vice versa. But I mean, I'm not seeing my friends or anything, but I'm still FaceTiming my friends, at least 4 or 5 of them every day. And we're having conversations and stuff like that. And we're still laughing, and it's still happy and fun. And we can still have a good time. I mean, it stinks we can't necessarily be face to face, but you can still really be connected. Social media is a powerful thing, and so is FaceTime on the iPhones we have now. So definitely use that to your advantage.
As a psychologist, I would encourage us to do a couple of things. One is absolutely you want to stay connected with folks, as Connor has said, and aren't we fortunate that we live in a technological revolution where we have so many ways that we can connect with our friends and loved ones. I think the other thing I would encourage folks to do is take a break from the pandemic and all the news. Folks are constantly looking at what Twitter is saying and what is the latest thing on the news. And we have news 24/7, as we know. And so you can inundate yourself if you so choose. I would ask you to take some time and step away. And then you really need to intentionally take some time to relax and to take care of yourself. So whether that is, exercise in your own space, whether that is meditation, whether that's yoga, reading a book, writing in your journal, whatever it may be, really important for you to engage in that. If in fact you are receiving some kind of treatment or some kind of therapy for any challenges that you're experiencing, and or if you are on medication for any kind of psychological challenges, you need to continue your medications. You need to be in contact with your psychiatrist if you need that to be refilled. And also, if you're in therapy, you need to continue that therapy. And many folks have found a way to do that. We know that in certain states, they've also kind of relaxed some of the rules around telehealth for psychologists and therapists. And that becomes really important so that folks can engage, whether it is on some kind of a platform, whether that be, WebEx or Zoom or TAO, which is a secure system for doing something like that, or the good old-fashioned telephone. You need to follow through with that, especially when we're seeing exacerbations of pre-existing mental health conditions because of the high levels of anxiety.
And I'm going to make a plug for an old school technology. So I have a 14-year-old and a 12-year-old, and I constantly tell them to turn off their phones, stop playing their video games, and read a book. Yeah. And I think that we have some really incredible time to take a break from the Twitter and the chatter and what you see on TV, and read a book and transport yourself to a new place and think about some new things, because we have the time now, and that might be a way to better connect with yourself. And then talk, and then Connor, get on with your friends and talk about the book you read. Wouldn't that be fun?
I just want to add one thing to what Dr. Hutchinson said. We don't want people with mild or moderate symptoms in our hospitals or in our clinics right now. If you have those symptoms, give a call, talk to your healthcare provider. If you need telemedicine, there's a great service out there. Anybody can download the app. It's called Amaze, A-M-A-Z-E. But we don't want people sick in our hospitals right now because they can give it to other people, including our own healthcare workers, for mild to moderate symptoms. Of course, if you're having trouble breathing, go straight to the emergency room.
Great point.
Absolutely.
Absolutely.
All right. What I'd like to do, we want to be respectful of everyone's time here today, but I do want to give the last call out before we wrap this up to our medical professionals on here. What's that message? This is a medical-based crisis that we are facing with this pandemic in the United States and around the world. What is it, that one message that you want the listeners to take away from today? If you could have them take a listen and act on one thing, what is it that you want them to do?
I'll go first and then give Marty the last word. what I want to say to everybody listening is that this will pass. We will get through this. And, you know, there might be some pain, there will be some suffering, there will be some loss of life, but we will be better for it. And I think that if we just band together and listen to the people that are, you know, with the most knowledge, that we will be better for this, and it will pass, and we will move on and be stronger.
Excellent. Thank you, Dr. Sachs.
I would agree with that. Look, 3 to 4 weeks of really asking all of us to make some heavy sacrifices and change our routines. And I think if you see other folks who are being a little reckless out there by driving community transmission, maybe with good intentions and bad information, have a conversation with them and think about those who are not only medically vulnerable, but those who are financially vulnerable. I do worry about people starving and not being able to get their paycheck. And this is our time for us to share. For, you know, God's been good to me in my career. I've had wonderful colleagues like Dr. Sachs at Johns Hopkins, and, you know, I've done well financially. This is my opportunity to think about those in my neighborhood, friends who may have trouble paying their rent, or folks that may not be able to get to the grocery store, and help them out.
Excellent. It's a great call out. And again, there's so many things that people can be doing in this moment. We want to pull up a quick slide just as a reminder, 3 takeaways for everyone here today. What you can do. You know, first, share what you've learned today on social media. Get the word out there regarding the importance and the need to social distance, to get out there and share some of the facts that have been shared with you from our panelists today. You can use that hashtag lead from home that has been trending around the world, it is not ours. It is something that, again, lead from home is something that it is a worldwide movement to get people to really take this seriously and to act on some of the things that you heard here today. Second, like we talked about earlier, stay informed. Use that CDC website, use the resources, follow Dr. Makary on his Twitter feed. And third, end of the day, stay home. Through the end of this crisis, follow those state and national federal guidelines and stay home. So with that, what I'd like to do is thank our webinar panelists today. Thank you for being with us. Thank you for sharing your stories, your insight. As I mentioned to all of you, the National Society of Leadership and Success is kicking this off. This is going to be part of a webinar series, so we invite you to come back. This is evolving hour by hour. We're going to be here to provide you updates as far as what is going on in this crisis and how we can continue to tackle it to get back to that state of normalcy that we all know that we want to get back to. But again, on behalf of the National Society of Leadership and Success, our 1 million members, our 700 partner colleges, we want to thank you for being here with us today, and have a good and safe rest of the day. Thanks, everyone.